Eric, let's go to the slides for the data. We'll start first with the daily data. Cases 1789. The good news is we're seeing what appears to be certainly a plateau in cases. We will feel better when it's really a defined downward direction. I don't think we can say we're there yet, but we certainly hope as more and more people get vaccinated, we're crowding this virus out, making it tough for this virus to spread. So it's still at a high rate, but it's certainly not going up, and we're seeing certainly a very significant leveling off. If we look at the other numbers, unfortunately, our hospitalizations are higher than they have been. On the average, ICU is right what the 21-day average. Let's go to the next one, Eric. We look at this is all 88 counties. Again, this is the key indicator. Our top county, unfortunately, remains Lucas County at 357 cases per 100,000 over a 2-week period of time. So Lucas, Williams, Madison, Erie, Summit, Cuyahoga, Jefferson, Defiance, Ashtabula. Those are the top, unfortunately, the top counties. And lowest county is Gallia and Meigs and Fayette. So again, as we look at this, again, we would hope that this would all become white. We're still at a pretty high level, as you can see, about 3.5 times what the CDC says is high incident level. And this is appearing certainly more prominently in the northern part of the state. Eric, we'll go to the next. Again, this is the top counties. We'll go to the next one, Eric. Our daily slide. This is our daily slide of vaccine. First thing I look at comes out usually around midday, and certainly keeping an eye on that. These are first doses, 29,000. So not certainly where we want to be, not where we have been. We had days that were 80 and 90,000, and we've seen certainly a significant decline in the number of first doses. I want to look at the age groups, and I think the age groups are quite interesting because our older Ohioans, those numbers continue to slowly go up, even though they're already at a fairly high rate. Over 80 is almost 74.5%. 75 to 79 is 75.5%. 70 to 74 is 78%. That population has got the vaccine, and 65 to 69 is 72. And we drop off, from there. One of the keys going forward, obviously, is to get people 50 and under taking it at a higher rate than what we're seeing so far. An interesting, if you look at the first doses, I asked our team to break it out for just 16 and 17-year-olds, and not bad. Almost a fifth of all of them, 18.6% of 16 and 17-year-olds have now received their first dose. So that's what happens with our younger people is really going to determine how fast we can reach this herd immunity, how fast we can reach the numbers that we need to reach to make us a lot safer. Second dose, Eric, you want to put that slide up? And again, 66,000 first dose, second doses yesterday. So those numbers are hanging in there pretty good on the second doses. We are now at 38, going back to the first doses, 38% of the population, the total population of the state, and some people obviously are not even eligible. 38% of the total population of the state has got the first dose, and 27.5% are now fully vaccinated. Eric, we'll go to the hospitalization slides. Again, these are lagging indicators. 1243 is the number for today.